Hi, I'm Claire Terry. I'm the osteopath at Head to Toe Health.
Hi, I'm Jackie Morrell. I'm the nutritional therapist at Head to Toe Health. So today we are going to talk a little bit about why people come and see Claire for treatment. So Claire, what are the main reasons that people would come and see you?
Well, the main reasons people come and see me is because they're experiencing, well, the top one is experiencing pain, but also stiffness, maybe restrictions, things that are stopping them getting on with their everyday lives is the most common thing. So pain is definitely top of the list.
Yeah.
Followed quite closely by stiffness.
Yes.
And that stiffness can be in the bigger joints. Most obviously people come for pain and stiffness in the back.
Yes.
But it can also include the hip joints, the elbows, the hands and fingers, things that disrupt people's lives. That's what they tend to come for.
Yeah, that's great. So how do you first start seeing someone? What's the process of that first consultation?
Okay. So during a first consultation, the key thing is that I need to find out lots of information about the client. So when people come in, the first thing they want to tell me, obviously, is what's hurting, how long it's been hurting and where it hurts. So that obviously that's really important information we need to gather. But we also need to find out lots of other information that might not be immediately obvious as to why it's necessary, but we need to get a lot of background information about each client, because I'm trying to get to the root cause of why is that person in pain.
Yeah.
So if someone comes in to see me with a back pain, I need to ask questions about how long they've had it. Have they got a theory as to what caused it? Did it happen following an injury, for example? Have they had a shunt in the car or something like that? Or has it been developing over months or even years? Quite often people come to me and they've had a back pain or other pain in the body for a long time. They've been putting up with it for a long time before they actually come and seek help. So it's finding out the background to it, and then it's finding out information about their life, really. Each individual person is exactly that, an individual. So what's causing one person's back pain or joint pain is going to be totally different from the next person, and the ways to help it is going to be different. So we want to ask questions about other aspects of their health. Are they on medication from the GP because they've got other health problems? Are they experiencing other sorts of symptoms that they wouldn't necessarily come to an osteopath for, but are relevant in making sure that the treatment's safe and appropriate? So things like, have they got problems with their breathing or their blood pressure or circulation problems, nerve pain? All those bits of information build up a picture about the health of a person.
Yeah.
And then we would ask questions about lifestyle. So what sort of job do they do? Are they living on their own, or are they part of a family? Have they got responsibilities for children or caring for other people? Hobbies, sports, what do they like doing? What sort of a person are they? So all these things are really important when we're finding out that first appointment, what's going on.
And that is where the similarity is with nutritional therapy, because those are the kind of questions I would be asking as well.
Right.
Lifestyle, GP medication, any other health issues apart from the ones they've come to talk about. So that's really interesting that we are complementing each other with the questions, which is why you can make recommendations to me and I can make recommendations to you as well.
Yes, because we know that we're both coming from the same sort of exploratory angle for that individual.
Looking for the root causes.
Yes, exactly.
So some of your clients, you've been referring them to me for supplements. So what are the supplements you would generally suggest to people? And then maybe I can talk about the reasons I would also suggest those particular supplements.
Okay. Excuse me. So the main reasons that I would be considering supplements for any client is if their body needed a bit of support in a certain function. So that is often pain relief.
Yes.
That's a big one on the list because that's what a lot of clients are coming for.
Yes.
So pain relief, stiffness, joint health and repair.
Yeah.
and inflammation. So those are the key things that I would be looking at supplements for. So there are certain supplements that I would often talk to a client about. So glucosamine and chondroitin, omega-3, curcumin.
They're the main ones.
The baseline ones, aren't they?
Yeah.
And sometimes if a client has quite a simple problem, very simple health, no sort of extra concerns, then I can suggest a supplement with confidence, and we don't need to sort of delve too much deeper. But if a client has other health conditions or a more complex case, then it definitely makes sense to get professional advice on nutrition and supplementation from someone like yourself, because you've got the knowledge to actually find out a bit more about that client and what's most appropriate and most helpful.
So the things I would look for particularly, so glucosamine and chondroitin, there's lots of clinical studies, decades of clinical studies on both of those and why they are beneficial for people with hip, joint, muscle pains. They help to slow down the degrading of cartilage, which I guess some people have in joints. They reduce inflammation, they reduce stiffness, and they can improve flexibility. But the thing with glucosamine and chondroitin is that if people have shellfish allergies, or they're asthmatic, have diabetes or medication for diabetes, or are on blood thinners, then we have to be particularly careful. It doesn't mean that they can't have them. It's just that we have to be more careful about the dosage. But if someone has a shellfish allergy, then unfortunately glucosamine is definitely not one for them.
Right.
Which is why it always makes sense to think about the person and ask those delving questions and not just pop along to Holland and Barrett.
Yeah, definitely. And glucosamine, I believe, is one of those supplements that you really have to consider as a longer term.
Long term, yes.
It's not going to be a quick fix. You're not going to feel a change within a couple of weeks.
No, so supplements in general are studied for about 12 weeks on a minimum. So with most supplements, you're looking at taking supplements for at least 12 weeks to see if there's any benefit. The supplement you may get more benefit from quicker would be something like curcumin. And we would use curcumin for inflammation, arthritis. It's particularly good if you have exercise-induced inflammation and muscle soreness. And it has been studied alongside ibuprofen to see its effectiveness, and studies have shown it is as effective as ibuprofen for decreasing pain and stiffness. And the benefit of curcumin is that it doesn't upset your tummy, so you're not going to upset your gut health. You're not going to get stomachache. You don't have to be wary about taking it on a full stomach. But again, you need to be careful because it can thin the blood. So you need to be careful of the other medication you're on. The other supplement you talked about was omega-3. Again, this is great for treating arthritis, bone health, joint pain, reducing inflammation. But omega-3, again, is something that we have to be careful about because it thins the blood. So with omega-3 in particular, you can take a lower dose. It will be effective at a lower dose, but for a longer period of time, which is why it's always beneficial to talk to a professional and not just buy these products in Boots or Holland and Barrett without having a look at the background information. Now, each of these will also reduce your blood pressure slightly. So if you are going to take them, again, please talk to your GP and get your blood pressure monitored regularly, because you don't want suddenly your blood pressure to go too low. Yeah. So these are all great supplements, and they can be taken alongside GP prescribed drugs, providing that my advice would normally be all supplements should be taken 2 hours away from all GP prescribed drugs, and then that way you make sure you're not going to stop your GP drug from working, and there's no interference with the pathways that your body is using.
Excellent. That's really good information. And out of those supplements that we've just talked about, the omega-3 is one that we could potentially get from our diet,
Yes.
if we know what to eat. But the glucosamine and chondroitin and the curcumin, that's not really the case so much, is it?
No, you can't get enough from your diet, so you do need to supplement, and it's a great idea to supplement. There's one more supplement that I have brought along today. This is a very specialized supplement. It's called Cellcore IFC, and this supplement is beneficial to your cellular health. So it works on a cellular health level. It is good for things like reducing your inflammation, because it works directly on your inflammation pathways, but it also supports cell repair and cell renewal. So it's a general benefit to your body. It's good for your immune system. It's good for mitochondria function, so it gives you more energy. So it could be taken probably alongside the pain relief, just to feel generally a bit healthier.
Yeah, that sounds really useful.
It's a very useful supplement, but this one is only available through a practitioner. You can't buy this on the internet anywhere.
Okay. So all the supplements that we've talked about are part of a program of treatment and helping a client work towards their goals of reducing pain,
yes,
reducing stiffness and improving their joint health. So when you take that alongside probably exercise prescription,
yes,
making sure that a person's getting good sleep and that they've got a good diet, maybe changing a few things around in terms of physical things that are currently aggravating their problem. So it fits into that picture really well. It's another tool in the box to help tackle a problem.
Absolutely. But you know, as we said at the beginning, this is a program that you should be thinking of over, say, 3 months at the minimum.
Yes, you can't just take them for a couple of weeks and hope that it's going to make a big difference. It's part of
that's right
of a longer term plan. Oh, that's brilliant. Thank you very much for talking about that with me today. I'm sure that would be useful for anybody that's listening to sort of understand the role of supplements a bit better in their sort of physical health, and if they're seeing a physical health practitioner, whether it's an osteopath like me or a physio or a chiropractor, how supplementation can be part of that and be really useful. Exactly.
And if anyone needs any more information, then please come and chat to me on a Thursday at the IBS clinic. Otherwise, you can book a free 30-minute session and talk to me on Zoom if that's easier for you.
Yeah, excellent. And if anybody would like some more information from me or to get in touch and have a chat about whether I can help you, my website is tonbridgeosteopathicclinic.co.uk. My email address is on there, my phone number. So just get in touch, give us a shout, and we can have a chat about whether osteopathy might be suitable to help.
Thank you very much, Claire. Have a great day, everyone.
Bye.